The Evolution of Hospitals in the United States, a weird mix of Mother Teresa and Goldman Sachs. How did we go from religious charity hospitals financed through charitable gifts and local government funds to hospitals bringing in annual revenues in the billions? Let's start with the definition of a hospital seen here. Nowhere in this definition does it say that a hospital's function is to make money and remain competitive in order to thrive in the healthcare market. Unfortunately, replacing nurses and physicians with hospital administrators with business degrees has resulted in less concern for care and greater concern for the bottom line. According to Sheehan Singh, hospital care consumes the biggest share of national healthcare spending. Elizabeth Rosenthal points out that from 1997 to 2012, the cost of hospital care grew 149%, with an average hospital cost per stay at $4,300. With this evolution of voluntary hospitals, we see a huge issue with the way that they are financed. Many hospitals set up this way allowed the financial contributors to make all laws and regulations on how the hospital functioned, leaving important decisions to philanthropists rather than trained physicians. While one would think that advances in medical science would be an all-around good thing, hospitals mainly saw this as a way to make money. Because they could offer better care and cure some diseases, hospitals began to attract the affluent, transforming them from charitable institutions to for-profit entities. With more money coming in, hospitals needed business-minded people to manage it all, which is where the field of hospital administration begins. Administrators focus on efficiency, resulting in major changes such as the burden to come up with new technologies while keeping costs low and the belief that hospitals should operate like businesses. Private health insurance was originally set up to protect both the patients and the hospitals against financial instability. However, during the Great Depression in the 1930s, many hospitals were forced to close, which resulted in the growth of private health insurance as a way for patients to pay for hospital services while pumping money into existing hospitals. America's two primary public health insurance programs, Medicare and Medicaid, helped to increase the number of hospitals and how often they were used. These programs provided access to hospital services for the elderly and poor, thus increasing hospital utilization across the board. Between 1967 to 1983, hospitals held the lion's share of market power and would set the rate for a particular hospital service and expected health insurance companies to pay the price, which they did. During this time, Medicare payments to hospitals increased from $3 billion to $37 billion nationwide. Under this reimbursement method, hospitals were paid a fixed rate per patient admission based on the patient's diagnosis. For example, hospitals receive the same dollar amount for all patients admitted for kidney stones, while they will receive a different amount for all patients admitted for pneumonia. This new reimbursement method incentivizes hospitals to shorten a patient's hospital stay at all costs. One patient admitted for an appendectomy might be able to go home that same day, while another may require a longer period to heal. Due to reimbursement, the hospital may prematurely discharge the patient who takes longer to heal, which could result in serious complications. Most private health insurance plans did not use Medicare's new reimbursement method because of its inflexible cost constraints. Instead, they hired negotiators to decide what amount of the medical bill the insurance company would agree to pay. The hospitals reacted to this by inflating the costs of hospital services to create leverage for smaller insurances or people with no insurance to pay higher amounts. Managed care was introduced in the early 1990s to help control rising healthcare costs. Most managed care organizations receive a fixed payment amount per patient per month, and then the HMO reimburses the hospital for services received by the patient. Three types of managed care plans that still exist today are shown on the slide. Managed care forced hospitals to be streamlined and cost-effective, which they largely were not. Therefore, hospitals were not very incentivized to attract these contracts. Many managed care plans were not run very well, resulting in failure to pay patient medical bills, giving them a bad reputation among patients, causing patients to choose other plans when possible. We can see that historically, hospitals have been incentivized to make money with little to no consequences. So it's no surprise that other ways to make money in the healthcare market began popping up in the form of billing, unnecessary treatment, and a disincentive to develop cures. If you've ever been to a hospital in Europe, they look very different than our hospitals here in the US. Rosenthal describes them perfectly as looking more like a middle school and less like a first-class resort hotel with marble flooring, fountains, and top-notch restaurants. That's because we are focusing on the wrong things and patients have grown to expect these wrong things. Instead of a patient wondering about the infection rates or readmission rates of a hospital, they are more concerned with whether they will receive a private room and what types of food will be available to them. This allows hospitals to continue operating more like hotels and less like healthcare delivery centers. The introduction of the ACA was a step in the right direction as far as introducing quality measures related to health that incentivize hospitals to provide high quality care because they can get reimbursed at a higher rate. For example, a quality measure introduced for patients with diabetes measures whether the patient actually has their diabetes in control. Along with beginning to reimburse hospitals for providing higher quality care, the ACA also implemented some penalties, such as not reimbursing hospitals for treating patients for conditions they actually developed during their hospital stay, and also penalizing hospitals for patients with excessive readmission rates. I want to end this presentation with this quote here from New York Times reporter Jacob Hacker. He is highlighting the need for government to regulate our healthcare system. With the Democratic debates in full swing and healthcare a hot issue once again, I urge you all to pay close attention to how the candidates plan to control and regulate healthcare costs.